of all, I'd like to acknowledge the Whadjuk people of the Noongar Nation and pay my respects to their elders past and present. I'd like to welcome you on behalf of UWA's Public Policy Institute. My name is Maria Osman and I'm on the advisory board of the Institute. The Institute is about tonight. I mean, I've seen many of you at the other public events, and it's about public policy, research and evidence. How do we inform public policy to have a debate and to look at how those decisions are made? And there's no pressing issue than the one we're going to hear about this evening. The public event this evening, Fortress Australia, how long can we stay closed, is really interesting. Even if you looked at every day in the West Australian, the headlines are telling us different things, and it's changing across Australia. So tonight's discussion, the current COVID international and interstate border restrictions, what will it take for Australia to open up, and what's the new world, what will it look like for those of us here? What we know is that Western Australia is very different from the rest of Australia. Melbourne's lockdown will shortly exceed that of Buenos Aires as the city with the longest lockdown, and there's pressure for them to open up. There's conversations around border restrictions. Is a national plan, exit plan, out of the pandemic possible? We're lagging behind, it's said, in our vaccination rates across Western Australia. And we'll have to live with the virus. And what does that mean when the virus, if and when it comes here? Those of us, and many of us are from different places around the world, we're cut off from our families across Australia and across the rest of the world. How long can we be separated? And are we risking people leaving WA altogether? Interesting debate. Tonight's panel, representing different areas of their expertise, will explore some of these themes further. The panel will be moderated by Professor Shamit Saigar, the Director of the Public Policy Institute, and there will be an opportunity for you at the end to ask some questions. We have a live audience and we've got 400 people booked in on Zoom. So we've got Zoom questions coming in. So those of you on Zoom, if you have a question, please, if you could identify which panel member you would like that to be directed to, and keep it really short. Tonight's event will also be recorded and available on demand on YouTube, and you'll receive a link to that in about a week's time. Feel free to engage via Twitter. Apparently the hashtag is UWAPPI #Fortress Australia. I'd now like to hand over to Shamit for tonight's event. Thank you.
Thank you, Maria. Can you hear me at the back? Wonderful, thank you. So as Maria was saying, I'm Shamit Saigar. I have the great privilege of being the director of the UWA Public Policy Institute. You're very welcome. Thanks for taking time out on what was a rainy day, and now the sun is out. When we dreamt up this idea of having a public debate, it was striking that, and this was just a few weeks ago, it was striking how it was the issue of the day, and that's just become more and more so in the period since. I can think of few things that people in a sense have on their minds but perhaps aren't discussing or debating in any sort of structured way. So I think it's a very appropriate use of the Institute that we are convening this. But more than anything else, although we're going to be hearing from panelists and they have proximity to the facts and the evidence, this is actually really about yourselves and there's hundreds of people online. So just to repeat, there will be some question and answer sessions taking place. There's some roving mics. I'm going to be the skunk at the garden party where I kind of limit your comments to, just a question. Be clear who you're going to identify as the person you're targeting your question towards. And then give other people a chance. We're going to make sure this is sort of free-flowing as possible. And we're going to handle the time that we've got in terms of two sort of areas. One is to recap on how we've got here. What's the nature of what's going on? What's the debate? How is it structured? What's missing? And in particular, are particular voices left out of that debate? And then we'll shift seamlessly to a different part of the discussion, which has to do with what would it take to open up? And what would that look like? So that's just a little bit of navigation. So I'm not going to spend too much time on scene setting, but you will know as well as I do that in 16 days from now, the Optus Stadium, I think it's over there, will be jam-packed full. The whole of Australia, which is footy mad, is going to be looking in at this spectacle, a national sort of occasion. not just a sporting event. And they're going to see not just people playing Australian rules football, they're going to see something that is really not obviously the case elsewhere in Australia. And it will excite different emotions. This is just beyond the sporting side of it. People are going to be thinking, well, are this group of people sort of out of touch? Does this look like the lost tribe of Southwest Australia? Centuries later, that people dig up our bones and wonder why we carried on living so close to each other, meeting each other, whilst everyone else was sort of trapped behind laptop screens forever and ever. I exaggerate, but to make the point. Or is it that they will look towards us and look in a piteous way and make the point that we have our sort of head in the sands, or we're in a bubble, but we're deluding ourselves? I mean, you're going to have to make up your minds, but it does strike me that there's going to be a point at which we can puff our feathers out in WA and say, look, we're hosting this. And it's a great moment of civic boosterism, but at the same time, it carries all sorts of mixed messages, all sorts of different sentiment, and possibly hidden dangers. But you know, you didn't come here this evening to listen to me. We came here this evening to listen to this group of people. So I'm just going to very quickly introduce them to you. I have sat to my immediate left, to your right, is Dr. Katie Atwell. Katie is a senior lecturer in the School of Social Science at UWA, one of my colleagues. She is, you'll see her on many broadcasts and elsewhere. She's an expert on the public awareness of vaccinations and the take-up in relation to that. And she's got some research projects underpinning that, which may come up in the discussion. I'm just going to go in terms of my notes. I've got Loretta Baltazar, who's sitting 2 seats away from me, just wave to you. Loretta is a professor also in the School of Social Sciences, a sociologist by background. She's also the director of the Living Lab. Have I got that right? The Sage Living Lab. And she's an expert on aging as well as migration, and she'll be sharing some of her insights. Sat next to Katie over here, this is the home team I'm getting off my chest to start with, is Professor Dirk Boer, who is a professor of finance and accounting over there on the left in this UWA Business School, where the PPI is also based. And Dirk is going to talk about some of the aspects of the economy and financial markets this evening and bring his expertise to that. But everything we do at PPI balances this with practitioners. This is not just experts talking to experts in a kind of academy setting. We are very keen to hear from people who run real institutions. And to that end, I have sat immediately to my right, to my left as you see it, Dr. Omar Khorshid, who is the president of the AMA Australia. He was previously, I think, state president here in WA, I think the year before last, is that right? Okay. We also have Phil Payne sat there on the end of the panel. Phil will be known to you within the sector, but maybe not beyond. He is the CEO of Study Perth, and he's actively involved in the international student sector. He'll talk a lot about that, no doubt. And last but not least, I have sat over here with a brightly colored tie. We have Kevin Brown. He's the CEO of Perth Airport, and prior to that, he had experience running airports in Queensland, but also in Edinburgh. So that's the team. Let me just get going now and talk a little bit about how we want to get the panel to interact. My first question I'm going to put, just want to get this discussion going, is to Omar. And I just want to talk to him a little bit about how he would characterize the national conversation in how we're looking at the medical aspects of the pandemic, and in particular, how this is playing out between different states. Remember, we're a federal country, and WA's position and predicament is important, but it's only in relation to other states. You want to shed some light on how you think that conversation is going so far, Omar?
That's a pretty tricky question to start with, and probably one I could talk for an hour on. Look, it's a very difficult conversation, isn't it? We've seen quite different responses from our state governments. We've seen different public messaging. We've seen anxiety in its extremes from certain members of my own profession through to what seems to be almost an indifference to the health outcomes of people. We've got anti-vaxxers, we've got a huge public health apparatus being pro-vaccination, and it's a big melting pot with a lot of high emotion. And a lot of people have come out of the woodwork as experts, and myself, I find myself talking way outside my own field of expertise all the time because I'm trying to represent the 100,000 doctors in this country. It is a fraught discussion, but I think through it we have succeeded. We have public policy measures that have led to us having the lowest mortality rates almost in the world from this disease. We have had the luxury, we thought we had the luxury of being able to wait for fully approved vaccines and then open up when everybody's vaccinated. Now the Delta's got ahead of us and we've hit a bit of a rough patch, but at the end of the day, I think we will look back and say, yes, it was difficult. There was a lot of different opinions. There's been a huge impact on every Australian, not necessarily a health impact, but a psychological impact, an employment impact, a financial impact. There's been an enormous impact on everybody, but when we get to the end of this year or the end of the middle of next year or the end of next year, whenever it is that when we can safely look back, I think we can look back with pride at the fact that our leaders, our institutions, our medical profession, our health workers, and everybody involved in the public health response have actually mobilised and they've kept us safe.
So just to probe and push on that a little bit, Omar, can I just ask you a little bit about WA? I mean, the point is, in a sense, the states are not in alignment in how they've experienced COVID. They're not in alignment in relation to vaccinations, and it must follow they're not in alignment in how they see the next 3, 6, 9 months. So how would you characterize what's going on in WA? And can I just pick a statistic out of this to get you to talk a little bit about this? One of the things that came out of National Cabinet, I think the week before last, was an estimation on the potential reproduction rate here in WA. It was a horrific moment. Is that something we should dwell upon, or is it just part and parcel of the scenery?
Okay, so we've been at risk in WA from the start because we went with effectively an elimination strategy, and I don't think it was a deliberate decision by government. They kind of stumbled into it, and in fact, many may remember Mark McGowan actually saying it was impossible to close the borders. It was unconstitutional. And yet when Tasmania did it, he then did it, and it became the centrepiece of WA's response. But it turned very quickly into an elimination strategy, putting all of our eggs in the basket of the borders and hoping that the virus wouldn't get in. Of course, when it did get in, it becomes an emergency, a panic, because you've got to get on top of it so quickly. And we have simply been lucky. There's nothing more to it. We have simply been lucky that we haven't had to face Delta in the way that New South Wales is facing it now. Now, we wouldn't have had the same responses as New South Wales, but we would have had the same impact, which is endemic Delta. I think it became very quickly realised that it was a popular policy and that bringing normal life within Western Australia was actually electorally very popular, and almost every patient I see is very, very happy with WA's response, even though those of us who have been watching and commentating on it have been saying, well, actually, this is dangerous. You know, if it gets in, by the time you realise you're going to have many cases and suddenly we'll be into lockdowns and we'll be in the same situation that other states have faced. And looking a little bit more forward, I do believe the government needs to be more honest with West Australians. I don't think they have been honest. We are not COVID zero. We're not ever going to be safe from this virus. And unless we can move that public conversation on to a realistic footing, like what we're seeing around the rest of the world, it's going to be impossible to ever open our borders. And I think that's the big political challenge for all our leaders, is how to go from we are safe, we're looking after you, and being adored for that, to actually saying, well, people are going to die from this virus, and that's okay, as long as we've done everything we can to prepare. And we'll talk more about that later, I'm sure.
Thank you, cheers. So Katie, can I bring you in at this stage? Now, you've done a lot of work on public attitudes towards vaccinations generally, predating the COVID pandemic. And then you've done quite a lot on how we've been going in relation to this episode. So there's two things that come to mind. And I want you to think a little bit about what's happening over on the East Coast in the last week or two with Victoria and New South Wales, where there has been an important pivot, as everyone's seen. What's your view about how you get those vaccination rates up to where they've got to? And what does that imply in terms of vaccination passports and mandatory vaccination? Just talk a little bit about that story and how it applies to us here in WA.
Well, I think it's immensely challenging. So we've seen just in recent days that Victoria and New South Wales are intending to move ahead with a form of vaccination passport. So people will need to demonstrate 2 doses of the vaccine to do things like go out for dinner. The Victorian Premier is referring to it as a vaccinated economy, that there's a sort of special economy that you get to be part of if you're vaccinated. Now, obviously, they're in the position to be looking at and talking about these kinds of public policies, I think in part because they are having to stare down living with the virus now. So they have given up on elimination, and as has already been raised, elimination is not actually going to be feasible for us here either. But right now it's a reality for them. So and the other point I would make is that having a pandemic actually in the community and spreading has obviously been an enormous driver of people in those states actually going to get vaccinated. Also, it's important to note that the technical advice changed in that pandemic outbreak setting before it changed in other places. So, for example, people of 18 and up being told any vaccine you can get your hands on right now, which for many people was AstraZeneca, is the vaccine you should be having. So that advice was different for them than it was for us here in Western Australia, for example. So I think in terms of those strategies of now having vaccine passports, of having a kind of 2-track system where you have greater opportunities to go and be part of public and private life if you're vaccinated, I think makes sense for them to be doing that now in a setting where they are still hiding from the virus, as well as accepting that it is running through their communities in a way that they can't control anymore. So those measures to get people vaccinated quickly and to offer incentives for people who are, I think are probably productive at this point. The question of how that translates to Western Australia is an interesting one, and I've been reflecting on the things that have been said so far in terms of the political capital that our state government currently enjoys and the immense popularity. You know, as long as we're here, for goodness sake, and going out for dinner afterwards and hugging our families and enjoying the great outdoors, you know, we've got so much to be thankful for, and we do put that thanks in our state government. But what are we going to do about getting the levels of vaccination we're going to need in order to reopen our borders, and then, as has been stated, to actually be able to face down that pandemic, which is coming for us, and it hasn't come yet. And I'm really starting to use that language. We have not had the pandemic yet. We've had little tiny outbreak fires that get put out, and then we're back to this kind of wonderful life that we enjoy. So what are we going to do to get our coverage rates up ahead of actually being able to reopen the borders and face down the virus when it comes? And obviously a strategy like a vaccine passport could be used as a way of doing that. It could be used as a broad-based intervention to say, this is what's going to have to happen in order for us to be able to open our borders. It could be done sooner. It could be done as an incentive right now. The risk of doing that is in Victoria and New South Wales, they actually have a direct threat they can point to. They can directly say, right now, there is a high risk, and right now, that risk is lower if you're vaccinated, and therefore we can justify controlling people in these different ways. Right now, like literally in this room, as long as there's no COVID here right now, the status of each of us doesn't matter. It will matter. It will matter immensely, but right now it doesn't matter. So for the government to introduce something like a vaccine passport here, I think they risk political division. I think they risk the kind of blowback that doesn't align with the enormous political support that they have, because we know that there are still people out there who are hesitant about these vaccines, not about other vaccines, but about COVID vaccines, or indeed who are still facing access barriers, or who are only just now getting around to being able to book in because they finally become eligible. So I think using a passport in this setting now would be a way of getting our rates up there, but I also think it would be very politically risky for the government. And I would expect to see that kind of measure coming in later in terms of readiness for an actual announcement of opening, as opposed to being a strategy that would be used earlier to get us ready for opening.
That's a fascinating answer. Can I just probe again a little bit of it? Everyone's come in here this evening, probably very casually paying attention. You know this, I'm making the obvious point. Very casually paying attention to whatever QR code system we've got going or not going, or you can barely remember to comply with. And so our day-to-day culture is quite a long way from what you seem to be advocating, and I'm quite sympathetic, which is some form of generating mild to moderate fear. How do you generate fear when there's nothing directly tangible? I mean, how do you reflect on closing that gap? There may be not a single answer, but that's a gap to be closed.
It is a gap to be closed, and different people in our political system and in our public life will need to communicate that in different ways, or will be incentivised or disincentivised to communicate that in different ways. And I've thought long and hard about how someone in my position who's often commenting in the public domain about the rollout, about vaccines, about attitudes, about what extent I should be taking a kind of fearmonger line compared to taking a positive line, talking about the good numbers we already have and the fact that people are turning up every day and what a moving experience it is to go to these mass vaccination clinics and see all of our fellow humans getting vaccinated. So we know that research on how people are influenced into vaccination decisions, we know work in previous settings shows that frightening people may actually make those who are hesitant less likely to vaccinate. So it sounds counterintuitive, but we have reason to think that if you're already kind of negatively disposed and worried, that other things that kind of activate those feelings in us just kind of make us shut down and resist, as opposed to scaring us in the so-called right direction. But as I've kind of grappled with these questions, as a West Australian, as a person with family here, with family overseas, with family in the eastern states, with, knowing that life is short and time is ticking, and knowing that, again, asking myself, are we kind of naive children playing in the sunshine, or are we, this kind of lost paradise that's just got it really good? And I vacillate between those two positions as well. But I'm increasingly trying to use the language of saying that we haven't had the pandemic yet, and it will come. And what we've seen in the eastern states is when it does come, as has been stated, people will die. The question is, will it come when our political leaders decide it will come? And to paraphrase a previous, Commonwealth government, we will decide the circumstances in which it comes and the manner by which it comes. Will that be our decision? Or will it come without us having that control? Will it come by accident? Will it break the boundaries in the way that it has in the eastern states? And we don't know. Not a single person in this room knows which of those two scenarios is going to be the scenario in which the pandemic comes at last to Western Australia. So what I'm saying to people is, given that we don't know that, I want me, you, these guys, everybody I love and care about, and people I haven't met yet, to be as ready as we can be. So I'm not trying to be a scaremonger. I'm saying it will happen and we don't know how yet. So let's get those vaccines into us.
So thank you, Katie. You're going to get some questions, no doubt, on that. So I'm going to shift slightly. So this event is actually about borders. We're trying to focus upon that aspect of it. And so when you look at borders, that's an obvious example where there is compulsion. I mean, we have rules. Who's on one side of a border, who's on the other side of the border is not something we just rhetorically talk about. We're policing it to a very high degree of success. So I want to bring in Loretta at this stage and talk a little bit about what your evidence and your insights suggest is happening amongst different communities here in WA, or maybe even across Australia. I mean, we are far away from other parts of Australia, other population centres. That means that many of our families will be in other parts of the country. Like many Australians, we've got relatives and parts of our family overseas. How's this pretty draconian approach to border control? I'm talking about international borders in the first instance. How's that going down, particularly amongst migrant communities here?
Thanks, Shamit. I think the first thing I'd like to say on that is, while we have been extremely lucky in Western Australia and the closed borders have been our friend in terms of, living in this paradise that very few places in the world experience, we haven't been unaffected because we can't visit our families and we can't be visited by our families, and our lives are a bit on hold, some more than others. So, for example, I'm involved in a large research project looking at youth mobilities called YMAP. And these are young people between the ages of 18 and 30, which happen to be the most mobile cohort of our population. And you'll all be very familiar with this idea of young people heading abroad for education, for experience, learning to be independent. Well, we have hundreds of these people stuck overseas, wanting to come home, many of them with increasingly difficult mental health situations. You know, they might have headed over to study or to work. They feel abandoned, I think, by the Australian government. You know, the sort of the default mechanism for this cohort is, if things get too tough, I'll just go home. Many of us have been there, right? This is part of our history of coming of age in Australia. So they're doing it really tough. They're in precarious employment, often not very good accommodation. We've interviewed 45 people, we've surveyed 800, and the results show this real desperation, I think, to come home. So we're not impacted, even though we live in Western Australia. The other thing to say is that we rely on migrants, and migrants have been really targeted unfairly. I can't believe that we still think migrants cost more than they contribute. It's just so hard to believe this. I mean, migrants have been targeted in the sense that they are, you know, the weakest link in transmission, and this is largely because they're doing the jobs that most of us would prefer not to do, and they're having to do several of them at once so that they can make a living. We don't blame the structural issues that result in this, we blame them. Migrants are targeted for bringing the virus in, but it's a virus, right? That's what viruses do. It's not their fault. Maybe it's about our quarantine or our processes. So migrants really are getting it in the neck, I think, really unfairly. I mean, the first thing when the pandemic broke, the Prime Minister said to the 2 million temporary migrants in the country to go home. And then he didn't extend COVID support payments to them, leaving them destitute. Many of them international students, young people like our Australian young people abroad. Same cohort, but here. You know, these people are doing it really tough. And we rely on them. We rely on them to do our care work. And maybe that's the last thing I'll say, because I can talk about this all day, is, you know, the other thing to keep in mind is migrants are really actually probably the best amongst us to cope with lockdown, because they're used to dealing with family separation. You know, that's what it means to be in a migrant family. So they're early adopters of technology. Even older migrants know how to, you know, video call their grandkids and like and lurk them on Facebook mostly. You know, so they really know, we can learn a lot from them actually about routine ways of staying in touch across distance to reduce anxiety, to, you know, have a schedule, have systematic ways of doing that so that we all feel connected. Even though we are physically distant, we feel socially connected. So they can cope well with that. But what migrants also need is the ability to have mobility rights. They need the ability to visit and be visited, particularly at critical points in the family life cycle. So when newly arrived migrants have their first child, they absolutely need grandma to come and visit. And we are seeing in another study, we have 300 migrant families that we look at, called Migration, New Media and Aging. And there we see increasing rates of postnatal depression simply because they don't have established local networks to draw on. And everybody knows what it's like when you bring, you know, your first baby home. So people really need, I think we need a new family reunion visit visa, which acknowledges the important role of visits. I can see pregnant ladies nodding at me in the audience. Because the other thing is, these are not just about compassion and the very important work of of support and care and mental well-being, they also contribute significantly economically and financially, because this is unpaid care labour that otherwise you'd have to pay for. And it means that you can continue to be employed in the workforce if you've got that care support. So I think we really, many of us have been really hurting, despite how we've also benefited from a COVID-free environment.
So thank you. We'll come back to that. But before we move on, can I just take this fantastically unscientific sample in front of me and ask 2 questions? Hands up those of you who have family members elsewhere in Australia who you've been prevented from meeting, or they you, in the course of the pandemic. Gosh, that's a lot, okay? Right, many more than I expect. And the same question internationally.
Yeah.
So that's an awful lot. That's about 90% of you. Either that's a 90% out there, or it's people who come to these kind of events, have these kind of issues or circumstances. Probably a bit of both. It was self-selecting, you know, Borders, Fortress. But I think it's important to get a sense that these things are touching our lives. I could go on to ask you the intensity of how you feel strongly about that, but that's for another day. Let's move on, okay? I want to bring in my colleague Dirk Bauer and talk a little bit about the economy. Now, one thing that the pandemic has done, and we're still trying to work this out, is the extent to which it's changing our understanding of how the economy actually works, and also how investment markets work. So my question to you is, how much have those considerations had an impact upon us both essentially being locked down, or the eastern states being locked down, and also the question of reopening? Have we got the assessment of the economy correct in all those decisions?
I think I'm surprised that we have now this debate and discussion to opening up in a plan, because I think that for too long we didn't have a real debate and no plan. I mean, you know that for many, many months there was no plan to reopen, not even a discussion. And that's important, and it's good news that we have that. What went into that decision, this, to me, relatively, I mean, I waited for that for a long time, but relatively sudden change in the government's position on reopening. I'm not sure, but I'm guessing that the estimates that the costs are just going up and up related to closed borders are becoming too high, so that they thought they have to change it. Regarding costs, I mean, what we just heard, I mean, I know a lot of people at unis, at UWA, for example, that the thought to go back to where they came from 10 years ago crossed their minds. And that can be very, very costly for Australia if all those high-skilled people leave the country, or never want to get here in the first place, all those very bright people out there on this planet. Because these extreme measures, the closed borders, I think they have done quite some damage on the reputation of Australia for the educated ones that talk to experts, that tell them, I cannot go back, and Australians cannot even leave the country. There's also no discussion about that. So I think the costs are very, very high. And I'm happy now that we have that discussion in the plan to open.
So let me probe you on that. I mean, look around. State is booming. We had a state budget announced this afternoon, significant surplus. This economy is doing well. You're going to tell me why in a second, but I'm just making the point that most people will be experiencing an economy that's doing quite well at local level. How do you reconcile that with some of your concerns about the nature of the impact of these rules and so on upon the economy?
Yeah, I think we are mining state, mining town, right? Iron ore prices really helped us with that budget surplus. More generally, financial markets, they also seem to be like in a bubble. When you look at it, I mean, everything went up, right? And it hides the true costs or some costs. For example, when you look at the ASX 200 or global stock markets, everything went up. But then look at Qantas, look at Flight Centre, look at all the travel stocks and many other companies, and then it doesn't look so good, right? There you see the losses and the costs. And so this is an important thing, right? And this also highlights that this narrative, it's a great narrative, but it's so wrong and so nonsense that we're all in this together. It's wrong when we look at firms and businesses, because the big ones, Apple, Amazon, they benefit from the whole pandemic. They are in this, but they are in this very differently to small businesses, family businesses. Big miners as well. I mean, they're like all good for them currently. And more specifically, I mean, the richer people, the well-educated people, they are not benefiting, but they could deal with the pandemic. They are in this together very differently to the poorer, less educated people.
Kevin, you run the airport. Once upon a time, a very busy airport, with the exception of the FIFO flights in the morning, probably a quieter airport nowadays. Can you just summarize the kind of discussions that's going on between people who run airports across Australia, how they're kind of reading this? There's stuff in the Sydney Morning Herald that talks about people being free to sort of start traveling as early as November, you know, one story after another. CEO of Flight Centre said there's going to be pent-up demand, particularly from families. How do you read this? How's your sector talking to each other?
Man, there's a lot happening in there. I think one thing from us locally, WA, we have a very high propensity to travel because of our geographical location. A third of our population have family overseas, and everybody in this room has not had that travel, as we saw from your quick poll earlier on. Yes, there is a pent-up demand, and before the most recent lockdowns, we probably saw interstate travel come up to about 70% of what it was pre-COVID. It's back down to about 20%. So as a quick summary, our international travel's down 97%, our interstate travel's down 70%. Intrastate is doing well, it's probably up about 7 or 8%. And that's important, and that's why it's been important for us in our sector to stay open regardless, and we have done so 24/7 over the last 18 months to allow the medical supplies to come in, to allow the fresh produce to go out on the aircraft, to allow Australians to come home. So it's been busy. It's a different kind of busy, and obviously we've played a key part in keeping that mining sector going, because that's been important not just to the state economy but the national economy. But there are a number of people that are impacted. We have a tourism sector which employs nearly 95,000 people in this state. It's worth pre-COVID about $10.5 billion. We have an education sector that's worth $2.1 billion a year and employs 14,000 people. So for me, the kind of conversations I'm having, I mean, the whole economic development, we see all of that through the airport, and we want to see it come back when it's safe to do so. But international students, leisure, the business economy, people being able to come here and operate their businesses is really important for the economic worth and the health of the state going forward. But yes, the mining sector is doing well, but not the hospitality, the tourism sector, the university sector, the further education. A lot of jobs are dependent on economic worth. And for me, the diversity of our economy is really important. If we don't have the students enrolling, and we had about 54,000 typically enrolling before COVID, Phil, I think the last 6 months of 2020, it was barely 6,000 or 7,000 students enrolling. So for me, the students don't come, the academics are not here to teach. We don't have the IP being developed in our sector, which is not then being translated into IP to diversify our economy. I keep hearing people talking about diversifying our economy, but we still follow a 7-year cycle of the mining sector. And the sector that was generating the most jobs in the last downturn in the mining sector was the hospitality and the tourism sector. So we do need the diversity in our economy for the health of our economy. But what are we talking about in our industry? The longer it takes to reopen, and again, I'm not advocating for it opening before it's safe and secure to do so, is the longer it takes, there's fewer airlines operating. They're retiring aircraft. The aircraft are getting smaller, there's less of them. And as other parts of the world open up, there's less fleet available to service our network. Let's not forget where we are geographically, and let's not forget that fortunate position we are in Asia, where 18 of the 20 most populous cities in Asia are actually closer to Perth than they are the East Coast cities of Australia, where we've got, 60% plus of the world's population within 9-hour flying distance. We have a huge economy in our doorstep, and we've got to be careful we don't become totally isolated from that. So we have to open up at some point. I don't believe anyone is advocating that we stay closed forever, but there is a lot of conversation about when will the borders open? Well, I think the only thing, as we've heard earlier on, is to get vaccinated as quick as possible. And I do believe the carrot worked better than the stick approach in the vaccination, because that's how we've worked with our team. I've got 95% of my team are double vaccinated. You know, we've worked hard, we've educated our team. And that's the one thing that worries me at the moment, if above all else, because all the other economic development will flow through if we're not losing our position on the stage. But we need the vaccination rate. There's two aspects to that, the supply and the demand. I'm not quite sure. I don't have enough transparency of the supply, but it's certainly, I don't think it's coming through quick enough. We're probably averaging about 22,500 vaccinations a week in WA. New South Wales is managing 100,000 on average per day, you know, so it's a significant number. So the supply is an issue. We need to make sure the supplies come through, but the demand, back to this anxiety issue, there's too much complacency in our state, and it's just waiting for the pandemic to come and bite us where it hurts. And God forbid it does, because many people will die. There is only one thing we can surely do, is to join that queue, get vaccinated as soon as possible, that when it does come, there's a reduced impact. I mean, I think the factor of hospitalisation, serious hospitalisation, is reduced by a factor, or the most recent information I've seen, by a factor of 25. You know, your ability to not shed, your viral loading is much reduced with having the vaccination. I think it's reduced by a factor of 3 for asymptomatic and a factor of 8 for symptomatic conditioning. So you're reducing the spread, you are reducing the strain on our health service, and you're giving yourself and your family and your community the protection. So we just have to get out and get vaccinated. At the moment, we're looking 3 to 4 months, 3 months to perhaps be 80%, assuming people still join the queue, maybe 3-4 months to maybe get closer to 90%, and I suspect it's going to get more difficult as we get closer to that number, because of some people who are just maybe a little bit hesitant. But for me, we need to be quite clear. What is the target? What's the medical advice truly telling us? And we need to define a date so that people actually have time to get ready and get the vaccination, because at the moment, with the complacency, people are waiting to see, and all you're doing is putting yourself at greater risk of catching this disease, and especially the Delta variant, which is transmissible, I think, 2.5 to 3 times more than what the original variant was. So you're going to potentially infect more people. You're at greater risk of being hospitalised, and we're not helping our world get back to normal. None of us want to see lockdowns. It's creating relationship breakdowns, it's creating mental health stresses. There is an increase in domestic violence. There's so many things that are not good with lockdown. Again, one way to help prevent those is to get vaccinated. It's that's the distillation of all this, is to get on with it.
Sure.
And the sooner we get vaccinated, the sooner we don't have to worry about these consequences so much.
Sure, thank you. And we're going to come back to what aviation may look like on the other side of whatever date is going to be set, or we're going to have to adhere to. I want to bring in Phil. Phil, you're CEO of Study Perth. Now, I think the audience might benefit from your characterization of what our student sector, international student sector, looked like before the pandemic. You give us a sense of how we were positioned in terms of that sector, either size of the economy or students, or a bit of both.
I was going to say I'd gladly do that, but it actually pains me to do that. My mic work. Yeah. It pains me because things are actually very rosy. Shall I grab the mic? Okay. Yeah. Oh, okay. Things are actually very rosy at the beginning of 2020 for international education. We had about 55,000 international students in the state. We were growing faster, our enrollments were growing faster than any other state or territory. We had new migration settings, which were a great attraction to international students with a migration aspiration. We had a new value proposition based on employability and enterprise. And we were all set. We had direct flights to and from many of our key markets, either in place or in planning, and we're all set for further growth, and things are looking very rosy for international education. Then the pandemic hit, and we have about 18,000 students left in the state, and they're doing it tough. It was great to hear Loretta highlight the vulnerability of migrants. I think you judge a society by how it treats the vulnerable
within the society, and I don't think we've treated international students at all well. They're doing it tough for all the various reasons that Loretta talked about, migrants. And if you look at where our international students come from, South Asia, Indonesia, South America, these are areas that have been absolutely devastated by COVID. And the majority of the international students I talk to have lost family members. And so we forget that it has an impact on these young people. Being an international student is a tough gig anyway. There's homesickness, there's anxiety, new culture, new language. In COVID times, it's doubly tough. And so we've pivoted to a large degree from recruiting and attracting international students to supporting the students that are here. We feel we have a real moral obligation to the vulnerable young people who've chosen to live and study in our community. And that's very much been our focus over the past year or so.
And can you just say something about where we might be in relation to our East Coast competitors?
Yes, gladly. Lots of surveys are being done over the past 24 months about student sentiment. So we have a pretty good idea what international students, their families and their agents are thinking about Australia as a study destination. And many have frankly written off Australia and New Zealand, which was a growing study destination, as a suitable study destination for 2021 or even 2022. Canada, US, UK is attracting a lot of students that would otherwise have been orientated towards us. Some states and territories are taking a very strong leadership role in this and formulating plans to bring back students, initially in pilot plans and then more scalable initiatives. Northern Territory have already brought back international students, 60 odd students through the Howard Springs facility. New South Wales has a very well-developed plan that was on the point of being approved before the Delta variant hit New South Wales. And South Australia has a fully approved plan that's ready to go when it's politically palatable. Our government in Western Australia has taken a more kind of watch and wait approach, which has caused quite a bit of frustration within the sector, but also it's not gone unnoticed overseas by international students, their families, their agents. Study Perth has been asked to lead the planning and the consultation for the development of a proposal to bring students back. So our mantra is very much patient but prepared. We want to be ready to go, to have done all the preparatory work, done all the consultation with federal agencies and local agencies, state agencies. So we're ready to go the moment we can and get international students back as soon as we can. It's very important to be seen to be doing this as well, to demonstrate an appetite to get international students back. There are three kind of categories that I'm most concerned about. The students who are already here, who need to be shown that we value them. The students who are stranded, they went back to their home countries for Chinese New Year in many cases in early 2020 and can't get back. And those that have taken a bit of a punt, enrolled at a West Australian institution in anticipation of coming on shore when borders open. And many of those are looking at the prospect of not actually getting on shore before their courses finish, and the majority are paying full fees. They're feeling abandoned as well. So, and then the third category are the students who are considering their options at the moment, and Australia and Western Australia in particular is not high amongst those options.
Okay, so I'm going to depart from the schedule slightly. I'm going to open it up to questions now. I'm very conscious that we've had a chance for the panel to get off their chest what they wanted to share with you to start with. But if I can just ask the people who've got the roving mics to wave them around. Is that right, Ching-Wei? So just let yourself, put your hand up and we'll get you. So the gentleman at the back, handily standing up so I can see him. You're going to be going first. If you just want to tell us who you want to direct the question to ideally and just keep it brief. Thanks.
Sure. My question has got two aspects to it. First of all, the vaccination and quarantine, and also targets, because it's not just one thing which I'm trying to get the answer to. So first of all, parents' visas is an issue for me. migration, agents and the visa problem of the parents is a really problem. And the second aspect is about international students. And as Phil knows, we've been supporting international students for a lot of, over the years, and we've been doing a lot of effort. And we have seen students committing suicides as well, killing themselves. Now, my question goes back to, rather than seeing this problem as a WA problem, why are we not focusing on what went wrong at the federal level and what is causing this issue now? Because at the one time, from my understanding, was WA went on an election on the back of a closed border, and we have a massive majority government. And what we have not seen, quarantine system. I've got family members in India stuck, can't come because we don't have quarantine facility. So there's few things that's impacting.
Is that, do you want Phil to have a go at that, or more generally? Phil, do you want to just have a quick go at that, or no?
I'm not sure I have anything.
Okay, who would like to respond?
I'm happy to have a go.
Okay.
So there's been some recent work written by some of my political science colleagues over East that was very interesting. That was, I think their piece was called something like "What's the point of Australia?" And they were making the argument, and it was an interesting argument that they made, that, you know, we've always seen Australia, we've seen the federal government as this really strong institution. We've seen them as the ones who forge our way in the world, who increasingly take policy areas such as education away from the states, such as health away from the states, and kind of centralise that power. But when it came to the pandemic, it was actually the states who found that they had all this power that they didn't know that they had, often hidden in sort of various public health acts, buried under, you know, piles of other pieces of legislation. And suddenly when you look at it, they've got these immense powers. So to the extent, for example, that states decide to close their borders to each other, that is in effect as well a closure of that border internationally. So I'm not sure that it's as simple to say one thing is happening at a state level and one thing is happening at a federal. I do take your point about the need to have, because quarantine is definitely one thing that the feds are still in charge of financing and resourcing. So I guess I'll, you know, just take that as a comment, but just did want to share that point that we are seeing a shift in federalism and in the federal state relations and the amount of power that each level of government holds. And I imagine that political scientists and others will be sort of dissecting the remains of this in years to come.
Thank you. Yeah, go on.
I think the other point to add is that the federal government is very, hopefully my mic will turn on. I'll just do that one. I'm back on. There we go. The federal government is very aware of its lack of ability to deliver on the ground services. They haven't got that arm that state governments do have. So when it came to quickly standing up quarantine facilities, the federal government hasn't got a hope. All they could do is put it out to tender and big companies will come along. So I think it was an acknowledgement by National Cabinet that although it's a federal responsibility, the only level of government with the capacity to actually do it with the states. And I think by and large, it's been successful. And we've got a lot of criticisms of it in terms of how it was organised early on, the size of it, the capacity, the effect it's had on families. But at the end of the day, it has been the key measure that has kept COVID out of Australia. If I could just quickly go on to another part of your question, I think, which was sort of going forward and quarantine and things. I think there are prerequisites to opening up that we need to talk about tonight, and I might just take the opportunity to do so. Clearly, vaccines are the one that we're all talking about, and yes, we've got to hit some number. The number is probably quite high, and that number is not set by a model by the Doherty Institute or any other institute. It's actually set by all sorts of factors. You know, as the doctor sitting here on the panel, one of those key factors is our health system preparedness. If we have capacity in our health system, we can deal with a large outbreak. But the reality in Western Australia is we have zero capacity in our public health system. In fact, it's already bursting at the seams without a single COVID case and with no flu. So, you know, we've got 6,000 hours of ramping. We've got a $5.6 billion budget surplus. And the government, who frankly should be ashamed of their lack of investment over their entire period of government. So I'd like to say we should open up at 80% Saturday and let's go, but I do not have the confidence our health system can cope. And it may well be that WA's number is 9, maybe it's even 95. I don't know, but someone needs modelling. I think that level of planning is going to underpin a safe opening up. Otherwise, all we do is go back in lockdown. I think we need to do is have that conversation that opening up is not Freedom Day. Opening up is not, opening the borders does not keep WA safe. Opening the borders means we go back into restrictions permanently. Okay, we go back into X square meters in restaurants, no crowds at the footy. That is inevitable. When the masks, absolutely. When the borders open, that's inevitable. And if we need to tighten those restrictions because the health system's failing, we'll go back into much tighter restrictions, including lockdowns. That is the future. And I think we need to be open and honest about that and prepare Western Australians for it. Otherwise, it's going to be very, very difficult. A couple other quick points in terms of prerequisites. We need courage. And I think that's something that our politicians are going to have to develop very shortly. They need to have these conversations. We need contact tracing. The Doherty model said, here's a scenario where contact tracing works beautifully. Low numbers of cases, low numbers of deaths, your hospitals survive. If you don't contact trace properly, then it's a much worse picture. And right now, we haven't had to do any contact tracing in WA. We haven't really, throughout the pandemic, we've not been tested. So we do need to get these things in order first. We've got a few months. We've got to get that vaccination target. We've got to get the plan ready. I don't know how you get the health system ready. That's a very difficult one. But at least we need to be honest about that. And maybe recognizing that, you have to then set that vaccine target at 90 or even at 95% if that's what it takes to keep West Australians safe.
Thank you, Omar. I'm going to take a question online. My colleague Rebecca is just going to summarize the question for ease.
So we have a question online asking, how are we going to get to 90% vaccination? So this is something that we're relying on. What are some steps that you consider would be necessary to get there?
All right, that's a good one. I'm going to ask him what to start with. Just keep it brief because other people can come in. Katie, if I set a 95% rate tomorrow and I was not going to be budged from that, what are the desirable and undesirable steps that we need to take to get there?
If you set it tomorrow, you'd need mandates. You would need a stick or a combination of carrots and sticks. One point I'd like to make is that we talk a lot about vaccine hesitancy and vaccine refusal, and these are real problems, especially for COVID vaccines. But people in our community also face serious access issues and access barriers. Let's not forget that many of us have only recently come online as people eligible to get the vaccine recommended for us here in Western Australia, which is the Pfizer vaccine if we are under a certain age. So we also have culturally and linguistically diverse communities. We have Aboriginal communities, including in remote regional areas, who have their own barriers, which may include, again, access barriers, or may include hesitancy or lack of information barriers. So one of the things we have to do is put a lot of investment into some of these communities who really need extra help. So in addition to whatever it's going to take to get the complacent over the line, we need to not forget that there are actually people out there who need bespoke services to come to them to help them get vaccinated or to help them answer the questions that they're waiting on or give them the information that they need in their language or in a way that's culturally appropriate for them.
Okay, thank you. There's a question at the back waiting.
Hi there. Back to the federal state contest, I guess you could call it. So we've known for over a year that COVID is transmitted with aerosols and wiping everything's probably a waste of time. And yet we've persisted with a quarantine system inside hotels with shared air conditioning when there were alternatives. And then on top of it, the states have been saying the feds are not stepping up on quarantine. But probably apart from Tasmania, all the states could have afforded to build those facilities themselves very quickly, especially WA. We could just write a check tomorrow, and yet it was not done. So what is going on? I mean, who cares who pays for it if you've got the money and it's going to cause, an economic catastrophe if you get it wrong? The other thing is we seem to have given up on elimination. We eliminated measles, smallpox, polio, etc. You don't say you're just going to live with it. That's not right. So we've got fast testing. We probably could design proper quarantine systems, and we can do quarantine testing. So why have we given up on elimination as a strategy? I mean, obviously we should be vaccinated as we can as a backup plan, but to be giving up on the rest.
Okay, so I didn't hear exactly a question. What is going on is not a question. But thank you for the point.
I find it remarkable that wealthy states just say, look, the feds have to pay for this, and then they sit there, while something's going wrong. It's weird.
Point registered. Let's have another question from the audience from this side. The lady, I think, in grey and black, halfway down.
Hello there, my name's Kate Brooks. I have a question for the panel. I'm keen to tap into their wisdom on what advice you would give to businesses, small, medium businesses, to help prepare for the next 6 months. When we've heard about possibly having more shutdowns if the borders open, masks, restrictions, but at the same time, are we expecting an influx of new talent to employ? Are we going to see some of our staff leave on extended leave? What are some of the things we can advise businesses to get ready for this change in our border restrictions?
Dirk, you want to start on that?
Difficult, right? Because cannot predict the future, but in general, my main point is that this, what I heard before, that this is paradise and we're so safe. I mean, when after I had to listen to what Omar said, and I knew that before, we are not safe at all. Since I know about the hospital system here, I'm very worried. So I think in general, I mean, if there's some issue, then I'm 6 hours in the ambulance and that's it. Or, I mean, I think risk management just means that don't think that you're safe. That would be my advice to businesses, right? This bubble is a bubble. Do everything you can to prepare for very different, more risky environment.
So does that mean preparing for more staff to be sick? I mean,
of course,
yeah,
can happen. I mean, if the staff, I mean, if I had a business, I would probably tell my staff, you have to get vaccinated. I would probably tell them that I have two Pfizer shots, no problem, do it as well.
Okay, so let me bring Katie in on this. So this is an area where you could have a government saying in a sector or an industry, staff need to be vaccinated and using powers of mandate. Or you could have the sector itself saying, as a trade association, we think it's in our interest. It might be the airline industry, might be something else. Where are you on trying to protect businesses using those approaches?
So my position is that it's always more desirable for governments to mandate vaccines for particular industries or indeed for general populations rather than for industries to go it alone, because mandates are complex. There are medical exemptions, there might be other kinds of exemptions, and it is governments who have the apparatus to manage those systems and to manage enforcement and compliance. However, one thing I would be saying that businesses definitely can and should be doing is not just demanding vaccination from their employees, but before we go down that path, encouraging it and facilitating it. Giving casual staff paid vaccination leave, giving permanent and fixed term staff paid vaccination leave, giving people an additional day or two of leave should they pull up a bit shabby after receiving their doses. These are things that businesses can be doing right now to help people in their workforce get vaccinated.
Rebecca, another question online.
Someone's asked for Dr. Khorshid. Let's hope our luck continues that we buy enough time to roll out vaccines and prepare. Is there medical support for the notion that COVID variants become more contagious but also less severe, e.g. as reported for the Spanish flu? How well is our medical system prepared for a potential outbreak, especially in our remote communities? Where do you think we are poorly prepared?
So why don't you go for the first of those, just emphasize that, yeah?
I forgot the first part of the question already, so I'll start with the second part, which is how well are we prepared? We're not well, I remember it now. We're not well prepared because we have a system that is saturated. We've underinvested, particularly in that public hospital sector, but we're also, just in terms of the detailed planning of how you run a forward-facing medical business, a GP practice, a private specialist practice, so psychologist, a pharmacy, how do you run those when any person walking in the door could actually have COVID? Do you have to wear PPE? That would seem a bit ridiculous, but if you don't, you're exposing your staff, and we know the vaccine's not 100% effective. So what does that look like? Who pays for the additional cost of slowing things down? So our health system is highly efficient most of the time. It's a production line, many parts of it are. But as soon as you have to deal with COVID, it slows down. You have to separate people with time and space. That's expensive. Who pays? And there's a lot of other detailed things around staffing and so on. In terms of the viruses themselves, now traditionally, if you look at the flu, for instance, yes, viruses as they mutate, you select the ones that are more transmissible, not the ones that are more severe. If you kill your host, it's not very good for your future as a virus. So generally speaking, viruses, yes, get more transmissible and less severe. And maybe this will turn into another common cold coronavirus in the future. But for right now, we've got more transmissible and just as severe, possibly a bit more severe, going around the world. And this does seem to be a unique virus. And I think we need to be preparing for this virus to continue to mutate, and we can expect it to be with us. I think someone said elimination, no chance, absolutely zero chance. COVID is here in the world for decades, probably. So we just need to prepare ourselves for that. What does life look like? And we also need to be prepared for the next pandemic. Let's learn the lessons. You know, Australia was miles behind countries that have faced SARS and MERS before. We just didn't take it seriously. It wasn't real. Canada had doctors and nurses die from, I think it was SARS, and they had done fit testing and N95 masks for every single member of the health system in Canada. A GP had been fit tested and they knew how to wear N95 masks. In Australia, nobody. They still don't. GPs right now, none of them have been fit tested. Most have no access to N95 masks. So the level of complacency we have in our health system is going to be a big problem unless we change our approach.
Okay, so I want to ask a question of anyone who wants to jump in. So there's a kind of global natural experiment taking place with different countries and a kind of trial and error getting their way through this pandemic, and in relation to not just border control. So we've got the UK, which amongst other countries has managed to break the link between cases, hospitalizations, let alone fatalities. Got the Israelis who've discovered you can do that, but also you've got to go beyond vaccinations. There's no sort of magic freedom data point you brought up earlier on. And you have also, you know, Singaporean experience, which suggests that there's lots of little micro things you can do, and you can sort of, to use the jargon, you can do a kind of risk-weighted approach. Wherever there's a risk that pops up, you try to get a proportionate result, and you sort of build into day-to-day life. So with that in mind, I just want to bring in Kevin on this. Just talk us through a little bit about what aviation is thinking about. You know, you put us into a sort of aluminium or steel tube, you send us long distances or short distances. Everyone in this room has grown up with barely thinking about what that involves, the proximity to one another. And yet COVID demonstrates that's not kind of a common way to sort of, you know, get ourselves around. I mean, how are you thinking about that future?
I suppose for us on the ground in terms of the airport, and being one of the first airports in the world to have COVID safe accreditation, we've had 6 million passengers through the airport since COVID started. Not as many as we'd normally have, but certainly a significant amount without any community transition coming through from that. But, you know, obviously the masks are still prevalent and still mandated in the airports. The whole air conditioning system has been reviewed. The spacing in the airport, the reminding people, the hand sanitisation, all those good practices which haven't just been good for COVID, but I think they've been good for the flu, and it certainly sounds like that's been welcomed by the health service in terms of the pressures that it's facing just now. So yes, and there's the HEPA filters and all this, but again, it goes back to the vaccination, which gives you that sense, it gives you that greater coverage, whether you're in the airplane, the supermarket, or in your home, or wherever you may be. You know, we've introduced a lot more seamless touchless biometrics that you can actually check in remotely online. You can come to the airport, it recognises who you are, print your bag tag, you put it on yourself, you put the bag in the system yourself, the biometrics recognises you through embarkation control, and we have now gates we've installed that you self-board. You don't actually touch documents and hand them over, you can keep your hands in your pockets. So we're certainly doing everything we can to make sure that it's a seamless, touchless protocol, and I know the airlines equally have their COVID safe protocols in terms of minimising the contact on the aircraft with the crew, and the safe wearing of, through the masks as well has been a great safety measure.
So I'm not surprised you've done that, and I'm curious. So presumably you think you can persuade people to go with that way of thinking and behaving in that kind of controlled way because they're travelling. Is there any suggestion that we could sort of adopt some of those mechanisms in how we live our lives more generally? Have you got anything on that as well?
Well, I think as we evolve, if we relate that to some security issues there's been over the years which have impacted aviation and the broader industry, there's certainly there's new protocols you go through in security nowadays you didn't used to. There's new health protocols that we'll carry on with. And we're already working with the government at the moment. That my concern is it's a very manual intervention process with the health authorities and the police at the airport. And that's on very small relative numbers. We have an international aircraft coming in and there's only 6 people coming off it, but it takes an hour and a half to process those 6 people before they go to quarantine. We cannot we cannot operate that way going forward, and that's why I believe there's a lot of technology, whether it's SmartGate technology that can scan your QR code and say that you've got the vaccine status, that you've got the right to come into the state while it's taking your temperature automatically. There's technology that can actually make it safe. We're also looking at trials with the Health Authority about rapid testing. Dare I say, through COVID for the last 18 months, most of our car parks have tented hospital facilities out the front. All the miners are being tested and health screened in the car park before they even come into the terminal. We're looking at, and that's with antigen testing, we're looking at PCR testing and rapid PCR testing that can be done in an hour, which is a much more accurate result. There's a lot of protocols being put in place where people are being tested 72 hours before they even come to the aeroplane to go in the airport. So I think a lot of these measures are going to become the norm, that you're actually coming as, you're clean, you're safe, you don't have to touch anything. You can smoothly go through the process. And these are just some of the new norms we're going to live with.
Thank you for that, Kevin. The lady at the back has been waiting very patiently with the microphones next to you, and the gentleman over here who's been waiting patiently as well.
I'd like to thank the panel for a very interesting discussion. The focus to date has all been on content and substantive matters. I think it's important to remember that we have a federal election in the first year, and I'd like comment from any of the panel to political considerations override risk consideration when it comes to opening up our borders.
That's a great question. Who would like to jump in? Off you go.
Is my mic working now? No. No, okay, I'll
go handheld again. Hi, Janice, nice to see you. I haven't seen Janice for a very long time. That wasn't a Vlad question. I'll give you one example about how sentiment can drive political decisions. From South Australia, so a little bit away from home, but not that far. In about November last year, the South Australian government announced their plans for a pilot, for bringing 200 students at a time through. It was did very warmly and positively by the Adelaide Advertiser. They ran a front page article that said we should welcome these international students back. They're part of our community. There was an editorial which was also similarly positive, but the backlash was instant and overwhelming. To the extent that the Advertiser ran a Facebook survey and over 80% of the respondents were very negative and said, why should we allow international students back when I can't visit my dying grandma in Queensland or my cousin who's had a baby, can't whatever. There was also, those are the more reasonable arguments. So there was a hell of a lot of xenophobia and just flat out racism. And it was shocking to read the backlash. I don't know whether we're any more or less xenophobic in this state. Probably about the same, I suspect. But I know that this, and then the South Australian government just pulled the plans immediately because it was driven by that public sentiment. I don't think the West Australian would have publish similarly positive sentiment, or certainly not in the near future. I just wouldn't imagine that. But I know that the West Australian government watched that development with great interest. So I think governments are following public sentiment rather than trying to lead it. Shall I hold this? Yeah.
Yeah, I mean, we don't have a good track record, do we? We don't have a good track record with government leading courageously. Someone asked for courageous government, and I certainly think we need that. I'm reflecting on the case of the extraordinary legislation passed for the, is it 9,000 Australians living in India and 600 vulnerable residents, and if they came back, they would be imprisoned. These are extraordinary measures, aren't they? And so public sentiment is not only leading politics, but I think politics is responsible for whipping up certain public sentiments. This is something we really need to be ahead of. Yeah.
Thank you, Loretta. Gentlemen, just here.
Thank you. From a scientific and a management point of view, totally understand the value and the need for measurement, and contact tracing is a classic example. But I just want to touch on the concept of the tyranny of measurement and the tyranny of reporting, because I mean, your comments about the airport, you know, the future could well be that we're monitored forever. However, I mean, at the moment, the technology is very cheap, easy to use, but as an aggregate, the cost is unbelievable. So is it just the economics of it that's going to constrain the overuse of measurement? And what types of measurement should be maintained in the long term at the borders to ensure that we don't, you know, enter another situation like this? Thanks.
Kevin, briefly.
Oh, the cost. I suppose there's the cost of that. The cost of the technology I'm talking about is a lot less expensive than having hundreds of nurses and literally hundreds of police officers and military personnel at the airport. So there's an operational cost of people, and there's like not being back at their other day job. So I think the technology can provide a solution. I think the essence of let's not kid ourselves in terms of your track around the world with your passport and your booking of your tickets and what you spend on your credit cards, you know, that's part of the security regime. And I think people will be willing that, you know, having their temperature taken or demonstrating that they're vaccinated or whatever, I think will be willing to do for the sake of the ability to travel, to visit their family and friends and go about their business. I'm not sure that there's necessarily going to be a huge privacy issue that's going to come out of that. But the technology is there, and you're right, it's cost effective, but it's much more cost effective than the solution at the moment. But the solution with the manual intervention at the moment is not, it's saturated. It can't grow. It won't be able to address the recovery.
Chingwei, the gentleman right nearby you, and I'm going to try and take you next after that. Brief, time's going to be short now, yeah?
Yep, Adam from CEDA. So my question, so you talked quite a lot about vaccination hesitancy, vaccination passports. I think it would be interesting to understand, given that there's still a large level of distrust with government and the use of data and, you know, managing health data, are we not potentially creating a class divide with vaccination passports with those who are hesitant not only to get vaccinated, but also to share health information with government and platforms?
Look, it's a really valid question. In terms of the data that is actually available linked to our vaccination status, it's fairly limited. So with the Australian Immunisation Register is the oldest electronic register in the world, and it's pretty old and clunky as a result of that. So it doesn't actually capture a great deal of information. So to what extent that's something that can be used as a selling point for our vaccine passport actually being fairly limited data that is available to be shared. In terms of perhaps the deeper and more interesting part of your question in terms of the two-tier society that it might create, I think it's troubling, yes, and I think that there will be people who are very concerned about it. But I think COVID has forced us to reconsider everything we thought we knew about everything. So, you know, this pandemic, this disease has altered the way we've lived since it came onto the world stage. And if vaccination status ends up being for a time period, a kind of marker between what people get to do or don't get to do, whether people get to work or don't get to work, I absolutely think we need to be having robust, democratic, open, deliberative discussions about it. Would I be fundamentally uncomfortable with that being used as a mechanism to encourage uptake? No, I wouldn't, because as Kevin so beautifully put it with the various statistics he gave, it is a way that we can protect other people as well as ourselves. So it's not now something that you just get to make a decision for yourself about.
Okay, I think there's a question just here. And then I'm going to get this guy in here as well.
Yep. Hi, my name's Ross Iopolo, and my question relates to to any member of the panel that wants to comment on Australia's government's public policy in relation to stopping or preventing or making it difficult for citizens to return home. And my concern about this is the future mobility of Australians to travel, or their propensity to want to travel abroad well beyond this pandemic. Has anyone looked at the constitutional validity of the Australian government's response to this pandemic in stopping or restricting our citizens to return home. Yeah, that's it. Thank you.
Loretta, you want to jump in first of all?
Well, I mean, yeah, it's a really important question. And we've seen the government respond by, like the Indian example, saying that people will be put in prison if they return from a country, even though they're Australian citizens. So it's really something we have to work out. And I think, I mean, more broadly, I think we're facing a world where we have to change fundamentally our behaviours. We have to get used to a new way of being in the world. That's not an easy thing for people to wrap their heads around. But that is what's required. We have to think of new ways of being in the world, including how to travel safely, how to get people back home safely, but even really small things that are so invisible and incredibly important, like we've got to get better at being able to visit people in residential care during lockdown. You know, these are people who can go for weeks and weeks and weeks without a visitor. And there's no border here except the front door. And, you know, it's not acceptable to continue because the rest of us want to stay safe. It's just not acceptable. So there are some really fundamental questions about being in the world and new behaviours that we have to invent with technology and other practices. Yeah.
Just to go a little bit further on that answer, I think quite specifically there have been some challenges to the Constitution, to the validity of some of the measures that have been taken, both the state borders and with Clive Palmer, of course, which was pretty widely publicised. And I think also there's been some people looking at it at the international level. And the government are pretty confident that they're on safe ground. What it comes down to ultimately is that balance between the risk of a hotel quarantine system that was not really ever fit for the purpose it was set for. It was an emergency measure that was very effective, but not properly designed, not properly invested in, and not of sufficient capacity to deal with the number of people that should be able to cross our borders safely. And unfortunately, it took a long time to get the fit for purpose facilities approved and for construction to potentially be starting soon. And they're going to be way too small for anything like the kind of volumes that we're talking about. So I think we just have to accept that was a chapter. It's going to be passed fairly soon as we get our vaccination rate up. And we will still need those quarantine facilities for people travelling from high-risk countries, or if there's a new variant that decimates the world and we need to bring in restrictions again. But at the end of the day, it was the capacity of the system and how much money the states are willing to put into those hotel quarantine systems.
So I've got one more question here.
Another one from the virtual audience. This is to Dr. Khorshid. But do you think that the medical costs of keeping borders closed, i.e. mental health and suicide, outweigh the benefits, i.e. lower COVID cases? We don't close the border for other viruses.
There's a very simple answer to that. Yes. The only thing that protected Western Australia and Australia from the decimation of health systems we saw around the world was the speed at which the borders were shut, and our government's willingness and our population's willingness to accept very severe limitations on our freedom, both to travel but also to move within our own communities. So yes, it was harsh. Yes, there is absolutely a cost, not just mental health, physical health, probably excess deaths, although we've also saved a lot of people from things like the flu, in addition to COVID. But at the end of the day, there is absolutely a cost, but it is vastly, vastly, vastly outweighed by the benefit of not having our entire health systems overrun and still having to go into lockdown, which would have happened anyway, like it happened everywhere in the rest of the world.
Okay, so you've been very patient, gentleman right here.
Hi. So EY Australia published a thought leadership paper on the future of education, prompting, the higher education to think beyond the brick and mortar model, business model. So I guess my question is, when the fortress comes down, what do you think, how does the higher education sector will look like?
I'm going to ask Phil, many of us in that sector do look around at these beautiful sort of 15th century buildings from Tuscany and wonder, where are the students? Never mind COVID. So please, Phil.
It's a very good question. I'm the kind of person who likes to look for silver linings, and I think there has been, in the same way that, that vaccines were developed super quickly, the technology to try and restore our lives to normality is developing very rapidly. Technology within education has developed very rapidly to ensure that students get the best they can when they can't have face-to-face teaching, but also online support as well. So a lot of innovations have been expedited, and I suspect a lot of them will continue after the borders open. Having said that, there is still a very strong desire for face-to-face teaching from most students. The reason students go overseas to study is to get the full cultural immersion experience. You can't get that through Zoom. Having said that, I think the education sector deserves a lot of credit for mobilizing extremely rapidly and providing what is in the main very high quality education online and high quality support as well.
Okay, so time has elapsed, and my apologies for people trying to get in. I'm going to ask every member of this panel, and they're going to get 30 seconds each, I will police it, to respond to the following question. 3 themes have cropped up this evening: health, wealth, and mobility. And so looking at WA right now, middle of September, the next 6 months, the exam question is, what would you most advocate to ensure that we maximize our health, wealth, and mobility in this state? Katie first.
Vaccination.
You've got 29 more seconds.
Oh, look, no, I've spoken plenty.
Okay.
Vaccination.
Okay, all right, okay, fine. It's not compulsory.
I think leading into that, it's a public health campaign. It's to educate people as to why they should have the vaccination, give people the information, because at the moment it's far too silent. People are not being educated, and that will lead to the vaccination when people are given the information they need in front of them.
Dirk, health, wealth, mobility.
Invest in our hospitals. Make sure that we are really safe and not that it's just a bubble and an illusion of safety.
Thank you. Phil?
Thank you. I endorse everything that was said, but I also echo what Dr. Khorshid said about honesty. I think honesty in government about what's ahead of us and what we need to do to address what is inevitably coming.
That was similar to my point, which is I think we have to get the beloved McGowan to start shifting the discourse about chasing zero world having departed and moving on to a new discourse that gets us better prepared. I think the popular discourse in Western Australia is that we can stay safe by keeping the borders shut. And as we've heard, it's, we've got to get him to shift our thinking.
Omar, you have the last word. You've got 30 seconds if you want it.
I think I've got a few minutes, actually. Look, I think everything's been said, but you can bring it all together with a plan. We actually need to put in a whole series of steps before we open up. Let's use the next few months while the vaccinations are happening to actually make sure that the contact tracing's there, the health system's ready, that our businesses, our small businesses have got their COVID safe plans, our GPs have got their 95 masks. The population understands what is actually coming, that Freedom Day isn't coming, but something that allows us to, I guess, face the future with the rest of the world rather than being in a little hermit kingdom.
Thank you very much. So look, time has genuinely gone by, and I'm going to bring this to a close. I've got some responsibilities. First of all, to thank the panelists. Can I just ask for a round of applause for you? In addition, we've been aided very much by Maria Osman, who's from the PPI board, for the introduction earlier on. Thank you, Maria. None of this would happen, you have my word for it, unless Rebecca, Ray, and Anna Zenz were on the case, and they're sat over here, so I'm enormously indebted to them as their boss. Thank you. And Xingwei and Ella, who are interns at PPI, have been also invaluable in the whole experience. Thank you very much to them as well. If you're hooked on the PPI brand, but who knows how you spend your life, we'll be getting together next Thursday with one M. McGowan, for what it's worth, launching a book produced by one of his minister, Tony Booty. It'll be in the West Farmers Lecture Theatre at the University of Western Australia, 5:30, 6 o'clock. It's on our website, so look out for that and more besides. I should have also said that the YouTube version of this, which people often ask for, it will take probably up to a week. We've got quite a lot of stuff to sort of sort out in it, just in case you're keen to have that. And also there was a sign at the beginning when you came in, you may have ignored it, but I'm just going to reiterate it, which is that we implicitly got your permission to be photographed and videoed as part of that YouTube broadcast that will go out. So if you're here with someone you shouldn't be with, I apologize. If it's date night, you ought to get out more often. But with that note, thank you very much for spending your evening with us. Come back soon.